B, C, D plan, the one. Is it going to fix it? Have we cracked it?
It's not... What I don't understand is the money, right? So Therese Coffey, our new health secretary, says quite rightly she's going to put £500 million into getting people out of hospital into care homes. Absolutely right. I mean, this is an absolute basic for what you need. There's going to be an awful lot of money needed for all the rest. And we've just cut all the money that was promised to go to the NHS. Or have we? We've certainly cut the taxes that were going to be raised for it. So I'm in a quandary. I mean, I do think that getting people out of care homes is absolutely essential. Getting people into care homes, out of hospital, into their own homes, if possible, with people looking after them, that is fantastic. But it costs an awful lot of money. And meanwhile, I mean, the county councils, who are mostly Tory, are saying we haven't got the money to do this, and this was before they knew about her plans. So the problem is that the NHS, as we know, takes up more and more, and we need to do it properly. Meanwhile, care homes, 135,000 staff missing because they'd rather go and work in Lidl, where they get better wages and free food.
Yeah, but hang on a minute though, because it's not just about going to work in Lidl. I remember I campaigned for it on this programme actually to stop the ridiculousness. The vaccine mandates, you remember? We disagreed with those at the time. We disagreed with each other, should I say, on them. The care sector lost an awful lot of staff because it made people have these COVID vaccines or else lose your job. And a lot of people say, well, I'll lose my job then. So you've got a staff shortage for a variety of reasons, haven't you, in the care sector? And for some reason, we don't value carers. Why not?
I don't know.
Why don't we value our carers in this country? It baffles me. It really does. A, B, C, D. Have we fixed it?
Yeah, sure. We've just come up with another acronym. Everything's fine. No, sadly, we haven't. It is probably worth saying, to give the new health secretary her dues, of course it's right to try and tackle the backlog. Of course it's right to try and make sure that people can actually get a timely health appointment. Of course it's right to try and make sure there are more NHS dentists available to people. But there's no real plan for how the government's going to do this. We've just heard it's going to take quite a lot of money. Actually, even if you poured even more money into the NHS, and as Scarlett already pointed out, the NHS is taking an increasing share of public spending, which incidentally means we're spending less on the sorts of service that might improve people's health and stop them ending up in a hospital. Things like education and skills and green spaces and clean air and all the good stuff that actually makes us healthier in the first place. But actually, there aren't the staff, and it is care home workers, but it's also GPs. We've got massive vacancies in the health service, GPs, doctors, nurses. So I think it's right the government are trying to do something, but I don't think it's sufficient. But actually, I think the bigger problem is we're just not having the sort of conversation we need that's going to generate the ideas that's going to save the NHS. And that may sound very grand, but if you look at it now, we have never spent more as a proportion of our public spending than we do now on the NHS, and yet our outcomes are really pretty poor. You look at infant mortality, you look at whether you're likely to survive certain cancers like lung cancer or breast cancer. You look at actually, can our healthcare system prevent you from dying, i.e. can it save you from your illness leading to death? And we score really badly in international tables, really badly. And of course, we all know the population health is deteriorating. I mean, you made the point, Michelle, right at the start. What's the role of personal responsibility? Obesity is driving more and more cost in the system. We actually at Reform published a letter today in the Times, which was we got 10 former health and care ministers from Labour, Conservative and the Liberal Democrats, 10 former people who've been part of running the NHS, who came together in a letter today that we published saying the current model is not fit for purpose and we have to have an urgent rethink about how we deliver healthcare in this country.